Thank you, Mona. Thank you all for being here. We're doing reverse chronological order by age. We are so excited to present this panel to you, and I just wanted to start by acknowledging Ipsit Fahia and Mona Potter, as well as the rest of the TIPS Conference Planning Committee for having us and the privilege of working to create this panel on digital child and adolescent psychiatry, emerging perspectives. So I just wanted to take a few minutes to frame the all-star lineup of speakers we're all about to hear from, to talk a little bit about the epidemiology of pediatric mental health and issues of access. Because at the heart of what we're trying to do is we're trying to understand how we can leverage technology to make diagnoses more nuanced and efficient, create more scalable treatments, and improve the triaging of patients to the right type of care at the right time. So with that, I wanted to talk, as I said, about epidemiology. So mental health conditions in pediatric populations are very common. Approximately 1 in 5 children has a mental health condition. That's over 15 million children and adolescents in need of care by pediatric mental health specialists. We have the best data in psychiatry, but this is true for other mental health providers in terms of access to care, which I'll be talking about in a moment. But just to understand the impact of these conditions, in 2015, suicide was the second leading cause of death among youth ages 10 to 24. Every day in the US, 15 youth ages 10 to 24 die by suicide. And half of all lifetime mental illnesses begin by age 14, 3/4 begin by age 24. And of course, the societal issue of suicide speaks to big upstream issues of lack of access to care. So these are common conditions, and yet there's a huge shortage of mental health providers. This is not an electoral map, fortunately, leaving politics aside. This is supply of child and adolescent psychiatrists. So with that demand that we just learned about, there are approximately 8,300 practicing child and adolescent psychiatrists in the US. This is true. There's issues of supply and demand for other non-physician mental health providers, social workers, psychologists. It's just we have the best data in terms of tracking of the pediatric psychiatrists. For every one psychiatrist, there are 1,800 children and adolescents in need of services. So with the pediatric psychiatrists in the room, I don't know if anyone, I'll raise my hand, I still practice, I have fewer than 1,800 patients. So there's, I don't know if others fall into that category. So we are really needing to think in terms of how we use that scarce time. So the red indicates in this map severe shortage of providers, whereas the yellow is high shortage, and I don't think there's a state that's labeled as sufficient in terms of supply and demand, which is pretty extraordinary. And this translates to a lack of timely access to effective care for children and adolescents. And there's the handy rule of 20. Despite the fact that 20% of children have a mental health condition, only 20% of those receive treatment, and only a small fraction of those who receive any treatment receive evaluation and treatment by a child and adolescent psychiatrist. The average delay between onset of symptoms and biopsychosocial intervention for children is between 8 and 10 years. So the reason why I love being a pediatric psychiatrist, or as my colleague from NYU, Helen Egger, whom you're about to hear from, would call a fully trained psychiatrist, is that we are the closest thing we have to prevention in mental health. And yet, look at this delay. I mean, what would the world look like if we narrowed this gap of 8 to 10 years? You can only do better when it's that long of a gap. So with that, I'm just so excited to share these next 4 presentations with you from this esteemed panel of colleagues and friends. I'm going to introduce them all to you now. We have left a robust time at the end for discussion and questions, so please send them in. Overwhelm me on the iPad with questions, because our goal is presentations that are half the length of everyone else's, so that we have a lot of time for questions, which we're really excited to engage in. And if our lunch together today is an indication, we have a lot to talk about. So these talks are just an amuse-bouche to the things we want to talk about with you. So let me introduce each of the speakers. They'll be in this order. Anne-Marie Albano was one of the principal investigators of the NIMH-sponsored Child-Adolescent Anxiety Multimodal Study, and also the Treatments of Adolescents with Depression study, and is a treatment developer and provider to youth and families affected by internalizing disorders. She is professor in psychiatry at the Columbia University College of Physicians and Surgeons, and she is going to talk to us about virtual reality and the treatment of anxiety disorders. Melissa Brotman leads the Neuroscience and Novel Therapeutics Unit. Oh, it's just going dark on here. Okay. Sorry. All these things were changing on the screen, so I wanted to make sure you could see everyone's pretty faces. Okay. She leads the Neuroscience and Novel Therapeutics Unit at the National Institute of Mental Health Intramural Research Program. Currently, her neurodevelopmental translational research integrates basic and clinical approaches to the study of mood disorders in children and adolescents. Specifically, she uses affective neuroscience techniques to understand the brain-based mechanisms underlying severe irritability in youth, and leverages technology to guide the development of novel targeted interventions. She will discuss a cognitive control app that she created. Dr. Anthony Sassong is the medical director of the McLean Franciscan Child Community-Based Acute Treatment Program, or CBAT, an attending physician at Massachusetts General Hospital and on the faculty of Harvard Medical School. He is also an advisor in telemedicine at American Well. He is going to discuss running a pediatric psychiatric department, running a pediatric psychiatric inpatient unit virtually, and he has a lot to say about that, and I'd be remiss if I didn't say that we trained together in child psychiatry at Mass General McLean, so wonderful to have Tony on the panel. And then finally, we'll hear from Helen Egger, who currently serves as the chair of the Department of Child and Adolescent Psychiatry and the director of the Child Study Center at NYU Langone. In this role, she is working to develop innovative tools to gather, analyze, and interpret information about children's behaviors, emotions, and development. She was one of the first researchers to use the camera on iPhones to track eye movements in children with autism to aid in their diagnosis. We'll hear about that today. And we'll also hear about her most recent work, where she's led teams in developing apps that help parents learn more about their children. For picky eaters, for example, she's created what's been characterized as the Tinder for cauliflower. And I'm Robert Accordino. I'm on faculty at Mass General here as a pediatric and adult psychiatrist, and have the pleasure and privilege of serving as the Chief Mental Health Officer of Quartet Health. And I will be our moderator. I just wanted to point out that we're so fortunate in this panel to be able to explore solutions across the lifespan today, but in our panel on pediatrics, we are really fortunate to be able to explore technological solutions across different levels of care, from outpatient to inpatient. It's really unique. We're really just so honored to have these panelists with us. And with that, it's humbling to be your moderator, and break a leg.